Like, I'll just do a quick 10-second overview of the logistics. We are not live yet. We are going to go live right now. And I'll do a quick introduction, invite you all and welcome you to the webinar. And then we'll jump into the content. I sent out an email with a list of topics. Uh, if you have access to your email, you can look at it and, nothing out of the ordinary. So we'll be fine.
We'll be good.
All good to go, gentlemen?
We're good.
Awesome. Here we go. Hello, everyone. Good morning, good afternoon, wherever you may be. And I am so thrilled to present this webinar today, The Perfect Storm for Healthcare CIOs, How to Accelerate Digital Transformation while Managing Budgets, Nurturing Talent, and Addressing Competition. I'm your host and moderator, Paddy Padmanabhan, and I couldn't be more thrilled to invite my panelists today, John Kravitz, CIO of Geisinger Health, Daniel Nygren, CIO of Maine Health, and Craig Richardwell, CIO of Intermountain Healthcare. Gentlemen, thank you so much for setting aside the time and welcome.
Thanks for having us, Patty.
Yes, really appreciate it, Patty. Thank you.
Very good. So we are going to spend a couple minutes providing a brief introduction to Damo Consulting before we jump into the webinar. We are a digital transformation advisory firm built on healthcare and technology expertise. We offer digital strategy advisory services, technology strategy, partner strategy and selection, and digital governance and operations. I want to mention a couple things. The Digital Maturity Assessment Model, DGM, has lately become a preferred model for health systems looking to assess their digital maturity. And if anyone out there is interested in understanding how to deploy it and use it for your own organization, feel free to reach out to me. It's a 4-stage maturity model, and we've done over 50 assessments to date. We also have a comprehensive repository of digital health solutions implemented in the top 75 healthcare organizations in the country, and profiles of over 500 technology vendors. It's called Demo Intel, and we are making it available as a subscription offering to anyone who's interested. So if there's any interest, feel free to reach out to me on that one as well. Many of you would be familiar with the Big Unlock podcast. We are really, really proud of how far we've come with the podcast. We are now in our 4th season. We've interviewed over 120 C-suite executives in healthcare, and we were recently ranked one of the top 5 digital health podcasts. So for those of you tuned in who want to understand what healthcare leaders are really focused on, how they're approaching their digital transformation priorities, I encourage you to subscribe to the podcast. And I must mention, I'm so pleased that all 3 panelists on this webinar today have been guests on my podcast. A quick note on our affiliations in the marketplace. We are closely affiliated with some of the leading industry organizations. We are foundation partners to Chime, and all our panelists today are very active Chime members, and Dan and John are board members in Chime as well. So we really, really appreciate the work that Chime is doing, and we're proud to be Chime partners. We also recently became a preferred digital transformation consulting partner for the Healthcare Association of New York State, Haney's. And for those of you who are from New York and would like to understand what that program is all about, feel free to reach out to your Haney's contact or reach out to me, and I'm happy to share more information. With that, we'd like to jump into the webinar, and as usual, we always like to start with our first poll question, which you should see on your screen right now. What are the biggest challenges health systems are facing today with digital transformation? Technology partners / solution risks, budget constraints, talent shortage, conflicting enterprise priorities, Other. All right, we'll watch while the responses come in. So Dan, John, and Craig, this is going to be our starting discussion, and you can see the responses coming in. It's kind of it's an equal mix of a lot of things here. It looks like, and it looks like talent shortage is coming up as definitely a big challenge. I'll give everybody another 30 seconds or so to complete your responses and end the poll, and hopefully we'll be able to see the results. All right. Very good, very good. Got about 40 responses so far, which is pretty good. Okay, let's go ahead and end it. Can everybody see my screen with the poll results? All right. Okay, why don't we start with a quick review? Technology partner solution risk 21%, budget constraints 45, talent shortage, wow, 55%, and conflicting enterprise priorities. So, gentlemen, what do you think? How about we start with you, Craig? What do you make of this?
Yeah, actually, not surprising, obviously, to many of us. Matter of fact, I'm not sure you could pick one. Unfortunately, as panelists, we weren't able to vote. But if I could, I would have picked several of these. I think the talent shortage for me is troubling only from the fact that, historically, if we didn't have the expertise, we couldn't find the talent, we could look to third parties or managed services or other places to look for the talent. But they're having the same struggles as we are too as employers. So from that standpoint, it's really kind of a wider industry, how to go ahead and start developing that kind of talent into our industry. I think the one thing that's nice for all of us is the industry is getting so much press these days, and it really is a challenge to work in. It's attracting people from outside of industry, which is exciting that the talent pool, the potential participants are wider. And then there's many of us too that are looking at how do we advance the knowledge and the expertise of people either coming out of high school or certainly removing the traditional, college degree as a requirement and maybe not even a preference, but we really are looking to have some of those more like white collar skilled tradesmen in the talent pool. So I think it's creating great opportunities for people to think differently how they promote their skill set. It's getting a lot of wider within healthcare. The only one I will comment, and I'll turn it over to my fellow panelists, is the enterprise priorities conflicts. That's, for me, would have been number one, only because of the way that we're all getting pulled in different directions. And none of them are bad ideas. They're all very good ideas. It's just picking the best of the best, either within your region or within your markets, and they could differ based upon that. So as health systems continue to grow, they're going to have differing priorities pending what communities that you're serving, and that becomes a little bit of a challenge from a system perspective as how to prioritize one versus the other. So that's just a few comments to start with. Thanks, Patty.
John, Dan?
Yeah, so I would say, to me, conflicting enterprise priorities were my highest. However, talent shortage is a challenge for everyone in every industry. So I deal with that with a number of different approaches. But Craig is right. Even managed services are having a difficult time trying to recruit the talent, whether it's onshore or offshore. So that's been a real challenge. I've actually taken while I'm using those, I'm also taking a slightly different approach because we're probably down 10% of our IT population, if you will, as a whole. And, I thank remote work for a lot of that because people can live in a low cost community and work in a high cost community in Northern California or Seattle or wherever and reap the benefits of that, considerable benefits, which don't begrudge anyone an opportunity in their career. That's great. So what we deal with though is how do we reload, and it's tough because as we hire someone, we lose another person. So it's like we're almost at that that stable point of 10%, 90% of our population inverse. So I've taken different approaches where I go out and I meet with graduating classes of high schools and try to encourage them, as Craig was saying, into certification programs, because that's the quickest way I can get them, right? And then start molding them into our organization, which is important. Also meet with students that are juniors and seniors of college and encourage them to take part in internships, where I can then make an offer if they're a good quality candidate at the end of the internship prior to graduation, with a considerably lucrative salary for that too. So, we take every opportunity we can to try to get the talent in. And as Craig stated, people that are potentially interested in healthcare, because it's a different animal, completely different and more complex than anyone in other industries. Because I've worked in manufacturing, I've worked in distribution, I've worked in underwriting for insurance companies and wrote online applications when I was young in my career. And it couldn't hold a candle to the complexity of a person's life hanging in the balance, right? That is the difference. And we have so many areas that we continuously try to improve in those areas. That draws people, who really want to challenge, but want to give something back to people's lives. So to me, that's an exciting point. I know I went way down on the talent shortage rabbit hole, so I apologize a little bit for that. But getting back to the conflicting enterprise priorities, that's a challenge for us, because at any one time, I'll have 125 projects that are in process. That's ludicrousy. We shouldn't ever have that many projects going, but we do. So, trying to take different cuts, different approaches to demand management and how we govern that process, and truly align it with root learning to where we're going as an organization, all the way down into our teams, I think will be valuable. But that's still an experiment that we're working through. So I'll turn it over to Dan for his thoughts. Thank you.
Thanks, John. Yeah, Patty, I have to agree completely with everything John and Craig said. And we're also at Maine Health taking similar approaches to many of these things on the talent shortage. Both of the points that John and Craig made around trying to recruit the younger generation, trying to take advantage of internship kinds of programs, getting out in front of folks early in their careers, letting them know about the opportunities within healthcare and IT, and about the tremendous growth that it could potentially afford them. I think that's a very important angle on sort of addressing the shortage overall. The point that John made also was one that I wanted to make with my clinical hat on. There's tech jobs all over the place, but really there's a difference within the healthcare space and IT. And I think we need to emphasize that to potential candidates that want to come to us. It's not like working in other industries where you're all about the bottom line and sales and things like that. Of course, those things are important for us as well. But at the end of the day, we're about helping people. And that makes you feel good at the end of the day when you've had a particularly challenging one, knowing that ultimately your role is at an organization that sole focus is on improving the quality of people's lives and their health. That says a lot. And I think we need to emphasize that as we're trying to recruit individuals into our world. Now, this doesn't help me when John and Craig are out to try and hire the same people that I am. At that point, I like to emphasize that the lobster rolls in Maine are much better than in their respective communities. But for sure, I do think that this is a big challenge in front of us. The enterprise priorities is a big one for us as well. I'm not going to belabor it. I want to talk a little bit about the budget constraints. We're still really challenged in our community and in our facilities with the challenge that COVID has brought with it and all of its undulations and waves. In particular, this last one has really left us in a precarious position with respect to finances. And some of that is related to care that's been deferred and potentially just eliminated. Others relate to our own staffing challenges and so on. But the bottom line is that we've always been tight with respect to our budget. Our margins are super thin as a not-for-profit entity, but they're now even thinner than before. And the pressures are only greater. The number of competing priorities, like we've been talking about, are only greater. And that's making life exceptionally difficult. So there's no easy way around that. You've got to try and be efficient and focus only on those activities that are going to bring you the most value. But it is a very challenging thing that we're in the midst of as well.
Thank you so much. I think those were all very, very insightful comments. Let me close out the poll, and let's jump into the discussion. We are in the midst of a perfect storm, and the perfect storm is competition for patients, competition for competition for talent, which we just talked about extensively, competition even for medical supplies, from everything that I hear. And we've got all kinds of forces in play, including geopolitical events in another corner of the globe. So at a very high level, how is the healthcare C-suite approaching these, and what are the one or two things that are top of mind for health systems today in this macro context? Inflation, labor shortage, high interest rates, everything thrown in. John, you want to go first?
Yeah, certainly, Patty. Yeah, I think, part of the challenge is this is the world of a CIO. This is what we deal with every day. It's walking the tightrope, right? It's being comfortable in an uncomfortable situation, which is what we deal with every day. And I think, looking at it from a C-suite perspective, you just really need to prioritize what's going to make a difference, what's going to move the needle, what's the best patient safety initiatives that we can do. As Dan is a physician, and I know when he puts a CIO hat on, his physician hat is first, right? It's always about safety and quality of care that you're providing for, your consumer, your patient that you have in your bed or in your clinic. So from that perspective, I think that's extremely important to us. It's important to the C-suite that we cover, quality and safety issues. Inflation's a nasty thing. And as Dan had alluded to, and Craig to a degree, our margins were razor thin. We're in a loss situation because inflation is just tearing apart, everyone, across the country. Recession, yeah, we're probably bound for recession. Labor shortage, we already know we have that issue. That's something we've talked about. But, you've got to think of ways to be resilient, how you can change and adjust on the fly, because we absolutely have to be agile in our approach. We have to be able to scale what we do so we can be effective and efficient in the work that we're doing to be able to provide the best level of care possible to our customer, to our patients. And I say customer or consumer because I've almost been retrained to think in a digital world. And regardless of types of service we're providing, we have an academic integrated delivery network. So I've got a medical school and graduate school education, everything else, and I've got the health plan. So all of those are customers, no matter how you look at it. And patients, obviously, the first and foremost in our minds, but that's the way we're approaching it.
So, John, you mentioned the health plan as well, and you are unique in this panel because you have a fairly large health plan operation that's associated with the integrated network. What do you see as what is the top opportunity, if you will, that you see coming out of being an integrated system like Geisinger?
Yeah, I think from my perspective, I would say, we have the opportunity to work with subscribers from our health plan, convert them to patients. We do a lot of population health management for Medicare, Medicaid Advantage, our accountable care organization of about 100,000 members as well. And integration, interoperability is so critically important for us in a population health world, right? Because people don't only receive care in our organization, they receive it in the community. And so how do we connect that information, pull it together, help with care gap closures, things like that? And in the health plan world, HEDIS is so important, which translates to Medicare stars ratings, right? 5-star, 4-star, whatever it is. And, that's where we strive to be excellent in those areas and provide the best optimal level of care. For us, about 40 to 45% of our subscribers get care in our health system. We are using certain tools, digital tools like, CRM, to be able to do outreach, to do touch points with people, understanding people need to have communication and ability to share information. And we see that as valuable. So we're working very diligently to be able to do that, to make the subscriber from our health plan feel like they're connected into the entire organization. And for us, that's really important. So we're excited about the opportunities there, Patty.
Right, right. And Craig, I want to turn to you. You're going through a big merger, SCL and Intermountain. And of course, big mergers seem to be happening elsewhere too. We just saw another very big merger getting announced just a couple of weeks back, Atrium and Advocate Aurora. So from the vantage point of someone who's going through a merger and becoming a much larger organization, and you look at the macro environment, what do you see as the big opportunity, like one or two opportunities for now a larger organization like the one that you've become?
Well, when you look at kind of the merger coming in, I think for the most part, we look at organizations that have both been separately very positive. They're not really looking for somebody to help them out, both very successful coming in. It's a learning opportunity. It's an opportunity to learn from what other things are happening in other communities that you don't serve. And are those kinds of things that you can bring back and apply back to yours? That's kind of the first and foremost. So how can you kind of get some of those best practices and share those across? You have your natural economies and the things like that you will get out of anything of that nature. But I do think there's a part of our industry that's rather unique in my mind. And we talked about it earlier. So a lot of these macro impacts that are coming at us, when you look at healthcare, we do have that privilege of life in and of itself, or the quality of life that people have that most other industries don't have. And that's a really unique mission that we do have. But we also are a business. And so all these macro things that are impacting us with labor and inflation and supply chain issues, those are things that we actually have in common. And I think that's where we have to say, hey, let's break out of the healthcare industry. Let's talk to other peers that are in retail and in manufacturing, that are in other service industries that actually are running the same problems that we have. And again, that's where I think we can teach, but also very much so learn from how they're managing and handling themselves, and those things that we can apply rather quickly. The last thing I'll say is really on the collaboration side. I do think healthcare, because of the aligned missions that most of us have, when you talk to people like Dan and John, and there's a bunch of us that know each other fairly well, the collaboration that we have is very unique in terms of being, quote unquote, kind of like a small little family. I know when I get a message or I send something out to there's going to be an immediate response going back either way. And that's something that helps, because I think as opposed to being competitive that you might see in other industries, the collaboration is one that I think is rather unique within healthcare, because we're all here to preserve and to improve the quality of people's lives. So I think those are all unique, all very nice aspects of being in healthcare. And then the last thing I'll say, kind of like about the merger aspects of it, is very complex. There's a lot that goes into it. However, as you start to unfold and start unwinding things, it's very easy to critique things that have happened in the past. Oh, why, as opposed to really create what you want the future to be. And I think that's the opportunity of two organizations coming together, is to repaint that future and to start building ourselves toward achieving that future vision for the combined entities.
Yeah, and I think a lot of us are going to be really looking to learn from your experience, Craig, as you go through the merger and as you kind of look at the technology stack and how you consolidate and rationalize and so on. But I want to pick up on something you said a little earlier on, which is about learning from other industries in terms of delivering the kind of experiences that consumers are getting used to. And let me turn to you, Dan, for this question. in the current context, you've got a number of priorities. We already talked about conflicting enterprise priorities and so on. And Craig just mentioned that we need to learn from other industries to deliver superior experiences. So in that light, what are some of your priorities today when it comes to executing on a digital transformation program?
Sure, Patty. I think it's an absolute imperative for every organization in healthcare currently. I think we've all recognized that we as an industry have lagged behind other industries in this digital transformation and in putting some of these easier to use tools in the hands of our patients, our consumers. So I think that's priority number one in many instances for us is pushing that transformation forward. I think this was one of the silver linings of COVID, that it helped sort of stoke the fire of that transformation that was already underway to make it progress even more quickly and with fewer obstacles than we had before. But we've really only just scratched the surface. So, doing a better job at allowing our patients to do straightforward things, right? Be able to schedule their own appointments online. Whether that be for a primary care provider or a subspecialty provider, a straightforward thing that you would imagine we would have achieved by now. And yet that's not the case for most places. So things like that are absolutely top of mind for us and ones that we're pursuing aggressively. What I'd like to say, though, with respect to sort of this bigger digital transformation picture, is that I've always been almost equally focused, not just on the outward facing aspect of things to our consumers, our patients, but also inwardly focused. And my response to one of your questions earlier about how the C-suite is dealing with all of these issues, right? In many instances, again, this is, I think, silver lining for us as CIOs, is that in many instances, I know that we're now being turned to say, CIO or CDO or whatever your title is, how can you help us overcome some of these obstacles we've got? And so this is where I see some of the efficiencies and some of the improvements that we could deliver to our own care team providers within our organizations to make them more efficient, to take obstacles away from them. And so we're almost as equally focused on that sort of digital transformation as well as the patient-facing ones.
That's very well said, taking care of your own employees and internal stakeholders. I do want to spend a quick minute or two addressing the unique attributes of your individual marketplaces, right? Daniel, you're in Maine. John, you're in Pennsylvania, and Craig, you're in the Intermountain States. So is there one thing that maybe John and Craig, you could share with us that is unique to your population that you're addressing through your digital transformation program that may or may not be relevant to many other health systems? So John, how about we start with Geisinger? Tell us about one thing that's unique to your markets.
I would say maybe we're like a lot of rural America, although we are in urban areas as well with health, campuses and hospitals and things like that. So I think we're very much a simulation of what others are and what they deal with. I think what's a little different. So our population does, around our main campus, very rural area. With the exception of the city of Danville, which is quite busy and populated and moving, kind of like Mayo and Rochester, right? Like one of those similarities. But I would say our population is cradle to grave for the most part there, right? They kind of stay there their life in that general area and they receive services. I think what's different is the digital innovation things that we're doing. And one of those is patient identification with facial recognition. I'm really stoked about this opportunity because we started out in a small hospital that we just opened, a micro hospital, and we also did it in clinics, which were new too. And we had great results. Probably 92 to 93% of the population said, yes, I want to be part of this. And this is an elderly population. So that's why I'm excited, because I expect them to say, this is taboo. I don't want any part of this. And that wasn't the case. So, now we're rolling it to our big ambulatory surgery centers, multi-specialty clinics and everything else. And we're going to roll it right across the organization. And that's great at registration admission, to streamline a process, to use more automation, to less people having to get involved. Because honestly, it's not like we're going to displace people. We can't hire them. That's the challenge we have. And so, when that happens, let's make something good of it, right? Let's use technology and process and the people. So technology is the smallest piece, like 5% the process, people process technology, as we all discuss and know. But this is the beginning of something big. And so, right identification of patients, so critically important for medications administration, pre-surgery, eliminating issues in surgery. So I think this is going to be something that's going to help us immensely throughout the organization. And it's part of our cloud strategy as well. So it's working out really well, and we've been happy with it. So I'll just leave it at that, Patty.
Yep. I am familiar with that, with the facial recognition program. It's fantastic. It's got all kinds of benefits, including operating efficiencies and so on. Craig, would you like to share anything that's unique to your population that you're working on?
I think, Patty, I think the thing that I find a blessing is similar to some organizations. We are a fully integrated healthcare system with a rather successful payer arm. And I think that affords us the opportunity to not only look at from a value perspective, really try to be the model within healthcare for that and share it across. But we also have that diversity of populations. We do have very large urban areas. We have Salt Lake City, Denver, Las Vegas that we serve, as well as a lot of the rural areas. We have Montana, Wyoming, Idaho, you name it. So we have that diversity of populations that will allow us to truly prove out the value proposition of moving toward value-based care modeling. And with that comes, accessibility, affordability. There's just a lot of good things that will come about it. And we've been talking about it for years, and given the vision of our board and our senior team and especially our CEO, that movement that we're moving toward it is always in the mind of everything that we do. So similar to when John described a subscriber, I can't talk about a patient without talking about a member, right? And without talking about a consumer, and all those different pieces of how people may categorize themselves all become blended, yet they're unique needs that each of them have. And we've got to make sure that the transformation, the tools that we build can be linked among them all, so they can pop in and out, but also that they're very unique to the need that person may have. We're also privileged to be in some areas like Denver, Colorado, for example, that's very much focused on health. I've never seen so many people bike and run and outside in the fresh air than anywhere I've ever lived. And so there's that piece as well. So the focus of healthcare on the health side is a big piece for us, the health and wellness piece, in making sure that as people go through their care cycles, that we can try to continue to expand how much of their life is spent healthy and well.
Yeah, I think that's such a great point. I think lifestyle choices and being able to enable people to live healthy lifestyles outdoor and get fresh air and exercise, and fantastic. I do want to mention there's a bunch of questions that have started popping up in the Q&A, and rather than wait, I thought maybe I'll take one or two of those. There's one here that I think I'd like to start with John's response, because this one is right up your alley, John. How does cloud migration, data analytics technology improve the healthcare industry, and how do you see the future? John, you just made an announcement about a multi-year cloud transformation. Maybe you can take this question first. Why now? Tell us about that.
Yeah, I'm excited about this. This is something we've been exploring for a couple of years. But let me just kind of ground where we are as an organization already with private cloud, right? With a number of our major vendors are already in the cloud. Now, we host Epic, our Epic instance, so we have not had that in the cloud, but large things like ERP with Workday, Salesforce, ServiceNow, those are already in the cloud. So about 30% of our apps have been in a private cloud, which ultimately is in the public cloud anyway. But we're excited because we see opportunities here which allow us, as part of our strategy, we've implemented an API management platform, which helps us considerably with integration. That we did a few years ago, and that was in preparation for moving to the cloud. So we've had success where we do about 5 million API calls per day, and it just keeps rolling. It's getting bigger and faster. So we're excited about that. But our thought behind this whole process was, look, I don't want to be in the data center business. I'm in the support the business. That's what we're here for. We're here to make the business successful. We're here to make sure the patients in the beds are treated, successfully. We have great quality outcomes. We do innovative things like, guarantees when we do do surgical procedures, things like that, which was a long time ago with Proven Care. But that's what we're here for. I don't care about spinning drives or flash drives. I don't care about a room or rack fulls of servers, which we still have, by the way, and I'll get rid of over time. But, that's not what drives me. When I was young and I just came out of college, I was all stoked about having a big data center. But that's not the case anymore. It's how do we get information to the right point to make decisions? How do we do it timely? How do we utilize tools? And I hate the artificial intelligence buzzword, but it's true. And this is, machine learning. How have we learned from the past and improved processes for the future? So, I think this affords us a lot of it. It affords us agility, time to market fast, time for us to implement applications much sooner when we have API integration, not the old HL7 or EDI transaction sets that take a long time to build and test and test and test and fix and test and go. We now have APIs that we can crank in pretty quick, and that helps us. Scalability is great. The biggest thing for me, though, because I retire a lot of applications, because like Craig, with mergers or acquisitions, I did my share. We doubled in the size of our organization in a 5-year period, a number of years back. And then I have a lot of clutter. I've got a lot of applications that I still have. I'm trying to rationalize and get rid of because we standardize on our platforms. And so the key to me is when I take applications out in the cloud, all that cost goes away. The hardware cost, I don't hold the depreciation cycle for 5 years. The people that are supporting in the data center, in the cloud is going to be gone. The application hosting and license will be gone. So those are important. But for us, the ability to be able to turn things quickly, have state-of-the-art operations and disaster recovery, business recovery, the ability to be in separate regions of the country with opportunity zones, multiple data centers in those regions. And I'm looking at maybe the max of 3-second downtime when we're flipping between, zones and then regions. So that's what it's all about, the 6 nines availability, not 5 nines.
So John, let me ask you, this is a question that a lot of people ask, and I've had this question come up as well. Is cloud transformation, cloud migration, is it about cost savings, or is it more about, agility and performance? So what's your quick take on that?
I didn't go into this with cost savings, but when we did the modeling and the benefit realization schedules, I'm looking at multiple $1 million per year once I get fully in the cloud. And the key there, though, is to make certain my applications, when we migrate them, we don't do a forklift uplift. We don't do that because there is great inefficiencies of probably 85% inefficiencies in storage and compute. I don't want to pay for that. I want to make sure it's optimized for the cloud, whether it's a software as a service, infrastructure as a service, and really maximize the use. Very tight, very restrictive with the tools that will jump that up as we need to give more capacity. So that's where I'm excited. And for us, we're going into this thinking, honestly, if we break even, we're ahead because of the business continuity, business recovery, the agility, scalability, and everything else. It's icing on the cake to know that we've modeled it out and we think we could save $7 to $10 million a year over time. So that's really not our driver, but it's a nice side benefit, Paddy.
Yeah, and thank you so much for those insights. I'd love to get, here's a question from an international attendee, and hello from Portugal. It says, how do you believe interoperability can help digital transformation? As a CIO, What do you expect in this area? Dan, why don't we start with you? I know you've done a lot of work in this space, so would you like to take that one?
Sure. I think it's a prerequisite. I don't think we can think or envision a future of this digital transformation without interoperability being there as a foundation under which it's all working. John just alluded a lot to, API-driven aspects to what he's working on. And I think, with all of the FIRE work, as you may remember, in my former organization down in Boston, we were very forthright about building smart on fire applications. And all of these are based on these premises of interoperability and standardized frameworks around which everything is built. So I absolutely think that this is one of the key aspects of our work moving forward in the digital space, and without which I think we're going to be going a lot slower than we otherwise would like. So definitely, I think it's a must-have.
So on that note, would you like to comment on how far we've come in the last few years, and what is the unfinished business in your view?
Yeah, well, I think we're doing much better from our core platforms, our core EHR vendors, and the large, purveyors of the data, if you will. They have come quite a long way, and in part that this was because of the 21st Century Cures Act and so on. The mandate, if you will, to have some of these frameworks available and interfaces. I think that's been phenomenal. Where we're still lagging a little bit is with the applications, the third parties, if you will, that are layering themselves on top of these infrastructures. That's going a little bit slower than I would have envisioned originally, and what ideally, I would see moving forward. I'll give an example without naming names. We recently entered a partnership with a really forward-thinking value-based care organization. And I was surprised to find out that they were still working in a very HL7-driven, interface-driven world. Whereas I would have thought that, this is something that they would have capitalized on, these kinds of APIs and capabilities there. And of course, they are working on them and they're coming. So it's not as though they were oblivious, but this is the place where I think we've still got work to do. We've got the foundations of the house built, but now we've got to start to build the walls and the rest of the structure a bit more aggressively than we have.
Right. There's another question here, which was actually going to be one of my topics for the discussion. So I'll just go ahead and ask the question anyway, and maybe Craig, you can take this one first. What are you looking for when you select your vendor partners and in your vendor partner solutions today? And I'm going to qualify that question a little bit, because your vendor landscape, you've got your EHR vendors, then you've got your enterprise class vendors, and you've got this vast ecosystem of digital health startup solutions. So Craig, do you want to kind of walk us through how you parse through this landscape in the current context, in the context of your digital transformation priorities?
Yeah, I'll share a few thoughts when I look for people. And to be honest with you, it's kind of like the comments before about data centers and things like that. It's like, if you're a vendor, I don't really have time for you anymore. You're a thing of the past, but only people who really are going to be true partners. And when I look for people to be partners, one is a shared risk, to make sure that they have skin in the game. They have as much to lose as what we do, but also as much to gain, if not multiples of that, is what we would as well. So we both win together, we both lose together. It's not pointing a finger at somebody else. I had something recently as part of the migration where one of the partners that were selected, people were kind of pointing at the partner when they were expressing some frustration with the customer. And it was like, no. We picked that partner. That's us. So that's not even us doing our part. We're in it together. So when a partner doesn't maybe perform well, we don't perform well, because that's our selection. So I think that whole shared risk, and that we come at it with one. Two is a very aligned vision moving forward. What are you going to look like in 3 years and 5 years and 7 years? And really, how can you project that far out? Well, tell me, how far can you think you project? How far can you go? So that I can make sure that the things that I'm doing is aligned with you and that our visions are very much aligned. And probably the last thing I'll come on talk about is really the breadth. I don't want to deal with 1,000 different companies. I really want to start getting myself down from the thousands to the hundreds to as small as possible, because it allows me then to have more thought leadership outside of all of the administrative aspects of a partnership. So are you going to be a one-trick pony, or are you going to start moving to different areas? And you can understand where I am, so that if somebody is a partner with me, can you displace this other company? Can you displace that company? Can you do all 3, 4, 5 more things for us? Can you help me paint what the 6th thing is going to be out there? So I really want to make people sure that people are really looking to see how wide can they go with a lot of their services. So those would be the 3 things that I would point out when I look for a partner. The shared risk, that whole alignment of vision, and then also are you going to be able to build on and expand your ability to add value to me.
Right. And I picked up a couple of really important themes there: a long-term vision, a partnership mindset, and then not just like a one solution, a one-trick pony kind of thing, but a little bit more of a broad-based capability. So you don't have to deal with a vast estate of applications, but a smaller number. John, let me turn to you on this. And I know you've done some work in rationalization and consolidation. There are obviously risks involved in going with innovative solution partners, but it's like can't do without them either, because you do need the innovation. How are you making these trade-offs, and what happens when something doesn't work out? How do you address it? Do you want to talk about that, John?
Yeah, certainly, Patty. So we do a lot of innovative partner approach, and in our innovation area, we bring a lot of applications through. We don't necessarily contract for them. We do proof of concepts for them, and kind of throw it against the wall. If it sticks, it might be a keeper, or it might not. But the ones that fall and hit the floor, we sweep them up, get rid of them, and they're gone. And we do a lot of those. There are a lot that come in with big promises and poor on delivering. So I would say, part of our application rationalization, we have a whole management governance process over here. And then this is the sandbox incubator, if you will, where a lot of things can come through. And honestly, you learn over time to be cautious how you approach this. If you have something that's tried and true, that's a solid solution, but you have a flash in the pan concept, idea, innovation, be cautious. Don't throw all your eggs in that basket. Look at it, evaluate it closely, make certain it's meeting expectations, work with the business closely to make sure it's meeting their expectations, because, sometimes it hits 30, 40, 50% of it, but not the whole need for the business. And ultimately, that's what, from my perspective, that's what we're here for. We're here to serve. We're like the police, right? We're here to serve the community. We're here to serve our business. And we have to make certain that, these new applications, which have a lot of the new buzzwords and new concepts, they could be great. They could be the next second coming, but, really evaluate it closely and carefully before you throw the baby out with the bathwater, so to speak.
Dan, your thoughts?
Paddy, yeah, one thing that I would add as well, just with respect to selecting the vendors, partners, it's certainly not about the technology. Many times, some of the firms that approach us have good ideas, but they're ones that are purely based on the technology or the technological approach, and have not done their homework with respect to understanding clinical workflows and what the end impact would be on the users of their systems. So I'd absolutely recommend for those partners to make the investment in partnering with clinical entities, or bringing some of those folks onto your staffs, so that you truly understand what the worlds are that our folks are living in, and to understand how these solutions might make a difference or not in our environments. Because so many times, once we dig a little bit under the covers, we realize that these solutions would fall flat if rolled out into a real world environment. And that's just because of the inexperience of the folks bringing them to the table in what some of the constraints are in these situations.
Yeah. There's a bunch of other really good questions, so I'm just going to keep going with the questions here. We still have a few minutes left. So there's a question here about value-based care. Now, the shift to value-based care is kind of, we're moving towards it, but we're not quite where we want it to be. How does this shift towards value-based care or alternate payment models, capital, whatever you want to call it, how does it influence your technology decisions? Craig, do you want to go with that one first?
Yeah. Well, first and foremost, when you kind of brush our industry down, we're an industry all about data. We don't produce products, we don't make things, we make data, and then people make decisions based upon the data that we're producing. So first and foremost, it really kind of drives you toward the data and having the data be the voice of how things are going. And so as you start to use that data to make those kinds of decisions or directions, you find out that there are things that are more evidence-based, more science, things that are a little bit more of an art or a little more personalized. You start seeing how much of an impact you can have on that. So the digital engagement to me is a strong component of keeping people aligned with you as you start moving yourself over to value. The part of the intent of value is certainly to provide a high quality, high safety, low cost product from the care side. But on the health side of healthcare is a big part of the success or being financially successful with value-based care is the early detection, the prevention. What is your lifestyle choices? How can I help persuade you to other things? And that's where I think that the engagement comes into play. We really want to move ourselves toward where the digital engagement component becomes part of your rhythm of life. All of us have habits, and you get up in the morning and you may pull out your phone and you check your social media. You may check with your text. You don't really look at your email first thing in the morning. There's things that people do, but how can we make sure that health is part of that natural progression of what you get up to do every day or middle of the day or before you go to bed at night, and make sure that's part of it to help remove you away from having to seek the care part of healthcare. And that to me is just, I think hopefully we will see it, for all of us with children or upcoming grandchildren, that we start seeing an evolution of how that becomes part of your lifestyle, and that health is just like financial is a big part of many people. That health is also important to make sure that we're good custodians of our own health care and getting people to involve. The one thing that I'll say is when you look at health or health care, the patient or the member is really kind of the most underutilized resource. We don't really engage them as much. And if you look at what we've done in other industries in our life, I am a bank clerk, of 20 years ago. I deposit my own checks. I pay my own bills. I do all the things that somebody used to do for me in the past, but they've created tools that allow me to be able to be a better user, customer of that service. And I think that's one of our opportunities here is to move ourselves from, I tell people like telehealth and telemedicine, it's like, why do we do that? It's kind of like driving through the drive-through at a bank branch years ago when you had that pneumatic tube. I still have two humans. You have somebody on one side of the glass or the monitor, and I got me on the other side. Why don't we build the online tools, take the intelligence that human has or that ability that they have and make that so it's more of an online type of a service versus a teleservice where there's some line that's connecting two people. And so I think that's part of the advancement and the opportunity to get us to the value-based care is to really allow that accessibility, that affordability, but it's going to be with engaging people and taking care of the health of their lives.
Yeah, I just love the focus that you have on wellness and enabling your consumers, members with self-service tools, which is what we're used to in banking and a number of other industries. I just absolutely love that whole notion, Craig. John, you're a payer and provider. You must be having a unique opportunity and a unique take on the whole value-based care question. Would you care to share some thoughts?
I mean, value-based care for us has been probably part of our DNA the last 10 years or so, where we had really no downside risk, only upside opportunity. But now we're in that full downside risk or opportunity zone if you do it right. So I think there is a lot of opportunity, and data is the key. As Craig stated, we analyze data every which way we can possibly analyze it to make certain that we're, ingesting new processes into our workflows to be able to serve our customer better. The other part of this, and it goes back to digital, right? It's how do you make that digital touch point frictionless for the consumer? And how do you provide the level of service, mobile or desktop, if you will, from a web perspective, from a portal perspective? How do you serve information up, make it easier, make it so simple to get those services? How do you make them feel sticky, connected to your organization? And that's really what it's all about. It's building those relationships, and it generates new business. There's new opportunities by doing that, which is smart. And it becomes organic growth, not necessarily, we do acquisitions too, but if you can do organic growth and you keep your same customers, because it costs a lot more, as everyone knows, to recruit a new customer versus keeping a customer and keeping them happy. So for us, that's really important. And population health, or, just risk management is so important for us.
Well, we're coming up to the top. I could keep going for hours on this. A fantastic conversation. In the remaining few minutes, 2 or 3 minutes that we have, I'd like to go around a quick 30 seconds. If there's one thing that you would like to share with your peer CIOs, chief digital officers, based on your experience so far with your digital transformation journeys, that they could learn from, what would that one thing you would want to leave behind? Dan, let's start with you.
I think the one thing we haven't really talked about, Patty, that I think is critically important for the health of our own teams, really, both the IT teams as well as all of the care team members within our organizations. The last several years have been stressful, to say the least, and we all know about the impact of mental health and what it's had upon the entire world, really. But we're not immune from that within healthcare. And I'd say that we need to focus on that in our own worlds as well. And in particular, paying attention to members within our community. So as examples, we've really taken a strong stance, and we've now rolled out the ability to use Talkspace as an example for our entire care team population. It's been very well received as a benefit, and we think will truly help people. So that's one thing that I'll take this opportunity at the end to touch on that we didn't get a chance to cover, but I think it's critically important.
Thank you. That was well said, and thank you for pointing that out, Dan. Craig.
Yeah, what I would say is, kind of stay young, stay active, contact somebody, be very much engaged. Call people like John and Dan or anybody else if you have something. Don't try to solve the problems yourself. There's probably the answer out there somewhere, either within your network or outside of your network, or within your industry or outside of your industry. So just continue to know that you don't have the answer, but somebody does. And I would just encourage that continuing networking part. I tell you, for me personally, it's something that that I just continue to lean on, because there's so many brilliant people out there that can help you, with your role and with your community and your health system or whatever role that you play. It's really important, to continue that. And so never think you always have the answer, or that you have to have the answer. Just kind of know where to go. And you got so many people out there that are willing to assist, and take advantage of that.
Ask for help.
That's right.
John, you're going to have
Just
the last word.
real quick, I know we're out of time, but I would just say networking groups like Craig was talking about, and things that Dan was talking about as well. I have a lot of respect for these two gentlemen. They've done great things in their careers, but we all belong to one group, and it's Chime, right? Chime seems to be the thread that pulls us together. You mentioned it earlier. I've been a member for 23 years and have the good fortune of serving Chime on the board and chairmanship, and Dan will be doing the same thing. It's awesome. And it's a way to network and connect with people, because we're all willing to share. We're all willing to share this kind of information. We've learned, we've had bumps and bruises along the way, and it's really, really important that, people are open to asking, because we're open to sharing. And I think that's really important.
Thank you so much. We are out of time. Thank you so much, Dan, Craig, and John, for being on this webinar and for sharing your thoughts. And thank you to the audience for participating. There is going to be a poll at the end of this webinar just to give us feedback on how this webinar was so we can make it better for you next time. Thank you once again, and enjoy the rest of your day, and see you next time.
Thanks, Patty.
Thanks,
Bye-bye.
Patty.